Hi everyone, I'm Dr. Preeti and I'm very excited to share that all of us together are going to be talking a little bit about monocotyledons today. We all know the plant kingdom. We know a lot of families from the plant kingdom. We also now know the subclasses of the dicotyledons chart. But as homeopaths, some of our remedies that we learned in our schools and colleges, some of the keynote remedies that we use so often, we have not yet studied them in a structured, organized way. Remedies like Allium Cepa, remedies like Veratrum Album, Lilium Tig, etc. They all come under the monocotyledons group. And today we are going to talk a few cases and understand this lesser known group a little bit more in detail. So I invite Dr. Rennie to take the stage.
Allow me to share the screen. Preeti, allow me to share the screen.
Yeah, I think you can now. I already...
Okay.
Yeah.
So, hello everyone. I think by now you all know me. I'm Dr. Renisha. So, just if you all remember the participants of in-depth plant, this was my very first slide when we started this in-depth plant study. And what Preeti just talked about. We are limited more by what we know than what we don't know. That's what Preeti just said. No, we know a lot of remedies from monocotyledon, but as a just an acute remedies or just a remedy which comes during the course of treatment of the patient. But most of the remedies are unknown and we have not explored them enough. Like when we go in our kitchen, no, we see this wheat, rice, maize, millets, sugarcane, onion, garlic, coconut, turmeric, and the list is endless. And do you all know where do they belong from? They all are from monocots. You'll be amazed. Half of our kitchen items belong to monocotyledon. And these flowers, such beautiful flowers like lilies and orchids, like most of the decoration when we attend any wedding or whenever we get some beautiful bouquets, they are made of lilies and orchids. They are in our daily use. But why we are not using them in our homeopathic practice if they are so much around us? Very few remedies from monocotyledon like Saccharum officinalis or Veratrum Album or Lilium Tig are prescribed as a constitution. Most of other remedies, aloe and diascoria and Allium Cepa and all becomes an acute remedies. Have you ever thought of giving them as a constitutional? Let's learn all these remedies according to Yaki's understanding of the plant chart. Like as she has made a chart on dicotyledon, she has made a chart on monocotyledon also. Let's learn these remedies like cocos, which is coconut. Sorry, not coke. Then Triticum sativa, which is rice, vanilla, Arum Triphyllum, sabadilla, sarsaparilla. Have you ever given them as a constitutional? So let's learn what is monocotyledon. What are the characteristics of monocotyledon? We all know, no? This year has been declared as an international year of millets. All these millets, no, they belong to monocotyledon. They are old, forgotten, staple diet of the entire world. And now the entire world has gathered together to get it back into our daily routine life, daily meal. Lot of stress has been put on these millets as a very, very healthy and rich source of proteins now. So what we learned, no, throughout these 10 sessions of in-depth plant study, in initial session where we had explored that how this plant evolution occurred. Like initially there were algae and lichens only, and then this vascular plant came. And in vascular flowerless and flowers and fruits bearing plant like this angiospermae. We went into more detail of angiospermae and then we almost did 30 sessions on dicotyledon and now it is turned to understand monocotyledons. It's part of angiospermae, part of flowering and fruit-bearing plants. So we all wonder, no, what is this monocot and dicot? But we have done all this in our botany. Do you remember this picture? Like we used to draw this, no, in our 7th and standard botany exams. Like, what is monocot? Monocot has one cotyledon. Dicot has a two cotyledon. The major difference. And the sprouting leaf has parallel veins. Here the sprouting leaf has similar veins on both the sides. And this is the picture from where we had started understanding the graph, the table made by Yakir of dicotyledon. But if you see exactly above that, the monocotyledons are placed. They both run parallel. Like when you see, magnolia is here, the first subclass of monocotyledon falls here. When you see hamamelody, the second subclass of monocotyledon falls here. And it is so on. But in monocotyledon, as you can see, there are only 4 columns. And in dicotyledon, we have 6 columns. They both have a parallel problems. But monocotyledons are much less evolved. So this is how we can see, the same chart, this graph, this picture, I put it in a chart. So this is the center point here. And you see the 6 subclasses of dicotyledon here, which is downside, the 6 subclasses. And in the monocotyledon, there are 4 subclasses up. And the issues are same. Pre-separation here and there, the hero struggle. We don't have any column here. Then in the last 3 columns of dicotyledon, only 2 columns of monocotyledon falls, like poales, commonilids and gingers and orchids and lilids, most famous lilids. And column 1 and column 2. Column 1 has very, very few remedies. It's very less known. But eresids are quite well known. And there are 2 families in this, helicales and ericales. So this is an important graph chart to understand how they are placed. They are just, if you all know, aware of this animal chart made by Dr. Gandhi, it looks very similar to this, where the invertebrates are above and the vertebrates are down. And this is the chart of monocotyledon, which now we will be referring it more often during our monocot webinar too. But in monocot, what we see, there are 4 columns and only 3 rows. Because they are less developed. They are not that advanced like dicotyledon. So even in the rows, like according to the Erik Erikson 8 stages and the one more stage added by Dr. Gandhi, there are 9 stages in dicotyledon. Like this. But in monocotyledon, we have only 3. Like 3 stages are combined. Childhood and adolescence, young adult and late adulthood. And there are very few families, so they fall like this. From Elismatids, there are family Elismatels, which falls into childhood and adolescence. And Eresids, even this helicales falls here. But if you go to poales or gramineals, it does fall into adolescence and childhood, but along with that, you see a little bit of young adult features. And gingiberals, orchidales, juncales, they all fall into young adult and late adulthood. And in the lilids, you just cannot differentiate any age. They fall into that entire column. In the entire all 3 rows, you can see the themes in all the lilies. They don't fall into 1 or 2 particular rows. So they don't have their peculiar characteristic according to the rows, but their more peculiarities are according to the columns and understanding of the monocot themes. This is what I explained. The rows are not distinct as in dicotyledon. So they are mainly divided into 3 basic groups: early development, intermediate development, and late or mature development. So what is the difference? Today we'll just touch upon the difference between monocot and dicotyledon. And then we'll see some cases solved with these remedies. So in monocot, no, they are evolutionary younger. If you see that first slide, no, here. So you see, they have not grown here. They have not come up to here. They stopped here. Whereas esterils and all, no, they are evolutionary, they are much higher. But Yakir compares orchids as an evolutionary, they're the highest level of evolution. Orchids are something in monocot, they have developed recently. So it has a little different picture. But all other monocots are evolutionary, less developed. Dicotyledon, as opposite, they are more advanced in evolution. As we go in the column towards 4th, 5th, 6th columns, you see a lot of advancement in the flowers, the fruits, and understanding of the substance also. The monocots are struggling with oneness and separation. Mono means single, and they are still struggling with their own oneness and separation from the universe. But in dicot, initial columns we see the struggle, but at the same time there is a connection with the outside world. But in the later column, they define themselves in connection to the outside world. There has a distinct issues after separation. Here you can compare this as an invertebrate. Dr. Gandhi compares monocots with invertebrates. He says they look very similar to invertebrates. And dicotyledons are very similar to vertebrates. In monocot, there is main theme is only me. Everything is centered, everything is focused, only me, myself. But in dicotyledon, me in connection with other. There is an issue of development of the ego. There is an issue of separation. There is an issue of development of I. But that issue is in connection with the outside world. I see other and then I see myself and I want to develop my individuality. Whereas in monocot, they can see only themselves. For them, outside world does not exist. And that's why there is a lot of difficulty for them to survive in this world where there is a now at present this world is going through a dicotyledon phase where there is connection of me versus you. This monocotyledon finds it very difficult to survive, and that's why they develop deep pathologies. Reality is perceived as stemming from him and happening because of him. So everything starts from him. So reality, everything is perceived from himself, from his eye point of view. They cannot see anybody else's in their surrounding. Everything is me, and everything whatever they see is in connection with them. Like Yakir gives a beautiful example that a mother, like in 4th subclass, will see the child cannot accept the child growing. For the mother, child has to be child throughout the life. And the mother will treat the child as a child only, cannot accept the growth of the child because the monocot mother has seen that child initially into that form. Mother cannot accept the growth of the child. But in dicotyledon, what we see is building one's own center and yet maintaining contact with the outside world. They have to form their own family. They have to fall into love relationship. And then when we go into 6th subclass, they see the entire world. They want to make a connection with the world. They form groups. They work together. So dicotyledon is much more advanced compared to monocotyledon. Monocotyledons are mostly constituted by his internal being rather than by the external world. That's what I explained. No? Whereas dicotyledons sustain and nurture by contact with others, needing the other in order to define themselves. Dicotyledon need to see somebody to know that this is me and this is you. But in monocot, it's only me, me, me. They cannot see anything outside me. But that becomes very difficult for a monocot person also. Though we feel that monocot looks more selfish, but we have never experienced that, what monocot must be going through. Reality is perceived as a stemming from him and happening because of him. Same thing. You are building one's own center and yet maintaining contact with the outside world. So this is a major difference we see in monocot and dicotyledon. And this is what we are going to explore in our next sessions about monocot, that how we differentiate them from dicotyledon, and then how we understand each remedies in these all four columns. The four columns and the remedies listed in those columns we are going to explore in much in depth in our upcoming webinars. So now I hand over to Dr. Prajakta to share her case. No
Okay.
sound.
So, yes. Okay. So, thank you, Rennie, for this introduction. And I'm going to share a short case with all of you where we can see the glimpses of the monocotyledons and how that remedy has helped our patient. So, 38-year female, she came to us for her complaints of rheumatoid arthritis. In the background, her son was our patient, and he was diagnosed as a ADHD child, and he was under our treatment. And later on, she started the treatment with us. The main complaint, when we see as a chief complaint, there was a lot of this pain and stiffness in the joints, typical of rheumatoid arthritis kind of a pain that she used to have. This pain used to be more in the heat or in the summer. So something which was very peculiar. Along with this, there was this swelling on the ankles, along with nodosities. So she was suffering this since almost 4 to 5 years and was on allopathic medicine without any relief. The pains were tearing, violent kind of a pain. And it used to go from one joint to another. It was more when she is in motion. And she used to feel more about the irritability of the tissues and soreness. So we saw a lot of peculiarities of the chief complaint, okay, in the start of the case itself. In the if we see her workspace, okay, she was working as a project manager in a leading pharma company, and she's very particular and peculiar about her work, and very dedicatedly and sincerely she used to work. And there were incidences, when she had to get promotion, but then she couldn't get, and that time these stressful situation used to aggravate her complaints. In the in the workplace, what she used to feel that the senior management which is there is not giving me the appropriate promotion or appropriate appreciation for the kind of work that she used to do. And there were themes of the anger and lot of sensitivity around these issues. But she used to keep all her emotions, whatever she used to feel inside her, never used to express much. We also see this sensitivity at her personal space. She had incidences where she had issues with the mother-in-law and the sister-in-law, and during the pregnancy also she had an feeling that she was never taken care of properly or pampered her, or she never got the love that she needed during the pregnancy. And all these things has affected her tremendously. The behavior of family members or in the workfront affect her so much. So there was a lot of emphasis on sensitivity, how people talk to her, how people are treating her. So that sensitivity was very marked. And also along with that, there were few incidences which has aggravated her chief complaint. She used to say that with this kind of a sensitivity, she was unable to mix with people, and she was unable to go out socially, be active, and she has limited herself in one space where she's not much interacting with the people, because she feels that I'll be very sensitive to how people behave with me. So there was this issues, and when we go deeper into it, what was the feeling of the patient was that the incidences with the mother-in-law at the personal space and the front work front, mainly it was that, yeah, I was not included, any important decisions, when any important discussions used to happen at the workplace or the personal phase, and I felt left out in the group. So when we go deeper to understand it, there was this feeling or sensation of being left out, forsaken, alone in the world, and I will be excluded out of the group. Along with this, there were some dreams of, some animals like rats and snakes, and very weird kind of a dream that she used to get. This was the history that was available. How we understand, this entire history which was present. So what we observed was there was a lot of this sensitivity and reactivity issues. Why? Because everything what was happening to her was affecting her too much. So this sensitivity and reactivity to this was considered as a plant kingdom. When we see, there were issues when at the personal front, she was feeling that, my mother-in-law is doing this to me, or sister-in-law is doing this to me. And we go deeper into it, we understand that how bad she feels or how sensitive she is to this behavior of them was more important than what somebody else is doing this to. So we understand this as a plant sensitivity. Along with this, what we have in the background of feeling of being this left out, isolated, that she'll be expelled, or there is a feeling of this forsaken, which is a prominent sensation of the Lily Flore family, as per Dr. Shankaran. When we understand this as a personality, okay, what we see in her, she is the leader, in a project management. She is very ambitious. She's very important, giving a lot of importance to her work. It gives um, an idea to somebody from the strong personality. So when we analyze this with the plant kingdom, with the Lily Flore sensation, and it was more about me and my sensitivity and how things affect me. So we consider this into a monocotyledon group, which is in the sixth subclass of monocotyledon, as Dr. Rennie said. They are strong individuals in the monocotyledon. And with this background, when we learn about the rubrics, about some remedy which is very has a affinity towards the rheumatic complaints or the joints, when we studied, there were some rubrics which I took. One was the heat aggravation. There were only 4 remedies, in which one of these remedies which I prescribed. Then the symptoms of wandering kind of a pain, what she had. Along with these rubrics, there was one remedy from the Monocotyledon Lily Flore family was coming to Colchicum autumnale. And Colchicum autumnale is, from a miasm sensation point of view, is in the malarial miasm, because what she feels is that she's stuck in between this kind of a situation. So malarial miasm was prominent. So on the basis of this, Colchicum autumnale was prescribed to her, and her RA was, at a very high rate, and she really did very well. And retrospectively, we understand all the things, matched with the case and the remedies that we prescribe. So these kinds of different kinds of cases and the remedies about the monocotyledon, we are going to do this in the coming session. And to further, to share the cases and the remedies, I'll invite now Dr. Chanda to share her knowledge about this.
You can see my screen now?
Yes.
Okay. So this is a very old case of mine. This patient, I had seen him in 2007. So that time he had psoriasis over both the lower legs for 6 months. And then it started spreading to the hands. So that's when he came to me. And he said the skin feels as if it is being pulled with the itching. So his wife told me he's very fussy and stubborn about eating. And he has some weird ideas, because some kind of food will make him sick. And he was using his brother-in-law's office to run his business since 20 years. And what happened is 6 years back, the brother-in-law died. After which his sons, they were telling him to vacate the office. So earlier, he wanted to start his own business, but the brother-in-law did not allow him. So now if I have to vacate his office, where will I keep my products? There are so many products I have. Where will I keep them? So he said, I gave my life to my brother-in-law, but his sons did not give me respect. They should give this office to me because I've been there for so many years. They should just give it to me, but they want it back. And my neighbors, the shops in the neighborhood, they tell me, don't vacate the office. But the patient said, it's not in my blood to do wrong. I could have gone ahead in my life and I would have become successful. I've got big name in Matunga. I give genuine products to my clients. I have enormous goodwill. Then his wife told me that he's very naive. He talks openly with everyone and reveals all the secrets. You can't tell him, don't say this, don't say that, because invariably he say what is not supposed to be told. And earlier when his business was good, he made a lot of money, but he did not save the money. He just squandered it on his relatives. He got his sister's son married, and basically he likes to show off and boast. He likes when people give him respect. And he's very particular about his clothes. His clothes must be ironed properly. There should be no crease. They should fit him well. He should look good. And there should be an impression about businessman about him. That image he wanted. And he also said, I cut my hair and nails regularly. Then he was craving for ice cream, pani puri and bhel. He's very religious. He avoids going to temple in his locality because people can see his psoriasis. So he's very ashamed about it. So then he goes to a temple in a faraway area where nobody knows him. So this was 2007 case, and so that time we were just depending on the repertory and all that. So initially I gave him Staphysagra, sulfur. I think I also gave him Calcarea, Passiflora also, but there was no change. Then his son lost some 25 lakhs in business. So this patient, he had to sell his house and gold to pay off the money lenders. So then he stopped the treatment because he didn't have money. So then anyway, I called him back. I said, please come and take the medicine. So again, he was saying, he said earlier, I used to have 1,500 in my pocket daily. I mean, 2007, 1,500 was a big amount. And he said, I feel bad when money lenders come to my house. My name was good in society. My son spoiled my reputation. So then I repertorized the case. That time I repertorized the case, but I've lost that repertorization. So now I have repertorized it now, recently. So I have taken these rubrics. Psoriasis, then extreme desire, naive, squanders, foppish, religious affections, ambition, ailments from deceived, social position concerned about, hypochondriasis, and boaster, regard, and respect desires. So now it seems very obvious that I gave him Veratrum Album. So I gave him 200 followed by 0/5. And he did very well on the remedy. So like what I want to say is, old cases, just which have done well, you just revisit them and see how well they fit into the PEM method. Yeah. So, like Rainey said, monocots are, in evolution-wise, they're younger than dicotyledons. So they are less mature. So now I remember this patient was very childish. And he had some all vague eccentric ideas. He would refuse to eat khichdi, thinking that would cause him more urination. He would always bring his wife along with him. And he was a little bit arrogant. And like I said, he always used to come dressed very well. And he would come to me by train, from far, from Matuga. So he would come to me during when not during the rush hour in the train, because he did not want to sit next to people who sweated a lot. So he felt he was very different and special, and he should sit far away from people. And he was very self-oriented. Like, his wife was also my patient, but he wouldn't let her talk with me. Everything was about him. Me, myself. And he behaved as if everything depended on him, and that he had to take responsibility of the whole house. Actually, his wife was very sensible and very practical and very strong, and she was running the show in the house, not him. And this fellow had a strong ego, and he wanted to achieve high status in life. And he gave a lot of emphasis on honor. And like he said, yeah, he wanted respect from others. So, as we know, Veratrum is a king series monocotyledon. So now, like, when we know about monocotyledons, if I had known about this in 2007, I wouldn't have given all this calcarea and sulfur and strepsacria, right? So this is how PEM helps in giving the medicine, and the person can get better in a shorter time. Yeah. So this is all I wanted to share. So now I invite Titi to take over.
Thank you, Chanda, and what wonderful cases so far. So I'm going to talk about another small case. This is a young child around close to 5 years when I first saw him. And this child was basically an Indian who was now settled in US. The parents had shifted, during the pregnancy. And the child was diagnosed autism spectrum, and he had no eye contact. He had a lot of sensitivity to sound and noises, and very, very, very hyperactive, very, very aggressive. And the mother said that, the symptoms started when he was roughly 2.5 years old, and it was after the birth of a younger child. So, the mother had just delivered a younger baby, and this child, our patient, suddenly started regressing since then. She said that our patient, he absolutely disliked his younger sister. He would get irritated even with her sound. Like, the young baby, she would cry and cry, and this fellow would get more and more irritated and more cranky, and even harass this younger baby. So there was a lot of jealousy with this younger sibling. And another characteristic that came along during the history was that he would get very frequent diarrhea and gut infections. Anything if he eats out of the ordinary, he will develop frequent GI complaints, and sometimes with a lot of fever. And the characteristic was that when the child was unwell and down with these gut infections, his appetite would increase a lot. He would eat a lot, and he would not be able to resist hunger at all. So this was very characteristic, out of the ordinary. One would expect that the appetite is going to be diminished when the gut is not well. So that was another characteristic that came up. From the mother's history during pregnancy, the mother said that, she was alone during the pregnancy. She was in a new country, and the husband would go out to work, and the whole day she felt very lonely. And there was a lot of work, there was no help at home. She had a lot of physical discomfort during the pregnancy, and it was her first pregnancy, so she was very nervous about the whole thing. And she said that for her too, during the pregnancy, she would eat a lot. She would crave a lot of this junk food, a lot of sweets and desserts, and she would just binge eat a lot. So this is what we got. Now, when you start, this is the the key, the crux of the case. So when we start studying and understanding this, there is one common thread between the pregnancy, the mother, and the child, and that was this increased appetite, yeah, which was very characteristic. Another characteristic was the sibling, the tremendous jealousy when the younger child was born. That was a very clear ailments found that the mother said. Another characteristic was that very loud noises would, really aggravate. The child would shriek and shout and be very, very cranky. And one very important remedy, if you look at the rubric autism also in the repertory, that stands out is Saccharum Album. This is the remedy from sugar cane. And it's, if you've heard a lot of the doctors and practitioners are now saying that, there is something called a sugar rush, and in hyperactive children, we should skip sugar altogether. Yeah. In Saccharum Album, if you study, I think Clark writes that, that the child is hyperactive, he's fretful, and he does not care for any real appetite. All he wants is to snack all the time. They don't want to do any sort of hard work. They'll be very, very cranky and irritable and want of any interest in life. That's what Lippe writes. So, the devoid of, they're craving for attention all the time. They're craving for affection. They feel abandoned. They feel there is a lack of, devoid of something in their life, and they try to fill it up with sugar. That's how we say, carbs. Very interestingly, chocolate and is also in the subclass 4 of the dicotyledon chart. And sugarcane is also in the group of subclass 4. Oils, Rennie was talking about grains. So a lot of these carbs, sugarcane, it all comes under the group of oils. And this jealousy, irritation, want of love, feeling abandoned, wanting all the sweet things in life, trying to compensate for everything in life with sweets, is a very characteristic of Saccharum Album. You can understand this from it being in subclass 4. You can understand it from the nutrition line, the gut issues. You can understand it in so many different ways. And that's the beauty of studying remedies through this whole picture. You understand the substance, what is its role in history, how it affects us as human beings, in which kingdom it belongs, in which subclass it belongs. What is the inner age, what is the theme here? If we study it this way, everything comes along very, very beautifully. This child did extremely, extremely well. He's not out of spectrum yet, but he improved very, very, very well. He's doing great. So this was a little case from my end and a little glimpse of the Monocotyledon group. Can I ask Jyoti to come and share her experience? Jyoti, you're around? Yeah.
Yeah. Thank you, Dr. Preeti. I have one small case to share. See, till all these months we read mostly about dicots, but now it is a time we have to learn monocots also. Just give me a minute. I'll share.
Jyoti, we don't see your slide. We see a black screen. You want to stop sharing and start again?
Yeah. I don't know what happened. Sorry.
No worries.
Yeah.
Yeah, now we can see.
Okay. But this is... Yes, this patient is 48 years old. She used to bring lot of patients to me, like her aunt, her cousins. Can you hear and see me?
Yes, Jyoti.
Yeah. So I used to always wonder, she used to pay for everybody. And she used to say, no, no, this is my responsibility. I have to take care of my aunts. I have to take care of other people. So much she was. Then one day she said, I want to consult you. I have some problem. So I said, okay, tell me. So then she started, I am having IBS, irritable bowel syndrome. I pass stools 4 to 5 times in the morning. Then after my breakfast, it will reduce. Again, after lunch, I have to, whenever I eat something, I have to pass stools. It is semi-solid in this. And I will have itching and burning in my anus after passing stools always. So her immediate question was, doctor, is it related to cancer? That is a big fear for me. And she said, you know, I have come here for consultation, although I have to come for others. Now my friend's husband died. After his death, I have developed severe, fear of cancer. So he was diagnosed just 3 months back, and they have given very good treatment, but still they couldn't, he couldn't survive. So now I have developed that fear. That is the reason I came to you. And she said, I am not a fearful person usually. My husband worked in Air Force and I managed everything alone in different states. Although I had a language problem, she didn't know Hindi. She knew a little bit of English, but still I managed very well with 2 kids. So I never had all this, fear of things. I was very confident before. So I asked her, what must be the reason for your problem? She said, we are 3 sisters. And my father died when we were very young, when we were in teens. My mother took care of us very well. Although I am a second daughter, but I have taken all the responsibilities at home. That I could also see whenever she used to come, she used to tell complaints of others. And she used to say, no, no, yesterday I went, I gave her food. And so many things I could understand when she used to, come to my clinic. I was there always for my sisters and mother. And my sister is a diabetic, doctor. And since she got married, she has some problem in her in-laws house. So I am there for always. And I knew our sister was my younger sister was my patient. And she used to, this patient, today's patient used to pay always for her consultation. She never used to allow her to pay. So she said 4 years back, my mother got diagnosed with breast cancer. My husband left Air Force job so that he joined here some airlines so that we can help my mother in taking treatment. And whole treatment I was with her. I thought the treatment will be effective and she will come out of that. But my mother died. I think in 2-3 months, I developed this frequent stool problem. I couldn't take it. I thought now that I have to take everybody's responsibility. My mother is not there. I think that was a big stress in my life and I developed this. I have done colonoscopy 3-4 times because I always have that fear of cancer. But every time it says normal, no problem. But I take care of everyone. Anyone needs help, I am there for friends and family. Even that friend's husband, when he was diagnosed, and this patient from the admission to the, patient's last rituals, she was there with the friend and her daughters. So much of responsibility she used to take. So her sister gave some symptoms because she was with her and she knew me very well. And she said, my sister takes care of me as if I am a 9-year-old girl. My condition is not so bad. My condition at home, my husband takes care of me very well. Some small problems, every house will have doctor. But she thinks I am under, some prison or something. So she thinks it is a big responsibility. I am big responsibility. Every day she visits me. Actually, she needs help, but she doesn't agree. Patient is having hypothyroidism since 20 years. She is on allopathic medication. Elder and younger sisters are diabetic. Father died of heart attack. So I asked her, is it related with your periods? how are you before and after your menses? She said, I'll have 6 days of bleeding. I'll get once in 20 to 22 days. Profuse bleeding for 3 days. Weakness during menses. Because of this weakness, my routine gets affected. By the time I recover, I'll get my next period. Though I gave her aloe 200 BD for 7 days because she was in a, very bad condition. She was feeling very, very weak and I had to give her repeated dose. Follow up, I had to give, I think, 2 to 3 times same remedies. She is doing very well. But why aloe? That we'll see in monocot seminar. Do join. I think not much is talked about this set of remedies. So we will see you in Pune. Thank you. Bye bye. Yeah. Tell me more about Pune seminar,
you left it
Dr.
with
Preeti. Many
suspense.
people are asking me.
You left it with suspense that why aloe, we will hear it in the monocotyledon seminar. So good marketing strategy.
Yeah.
So
And
no,
also many people are asking me why in Pune and what other things we are doing. I think I would like you to explain.
Yeah, so as Jyoti mentioned, we are doing this seminar retreat. It starts from the 30th of November all the way till 3rd of December, where we're going to spend 3 full days studying and talking about monocotyledons. So every day, 3 hours, we are going to be studying this group with a lot of cases. And every evening, we will kind of have a 1 hour case discussions, where we'll have also the participants contribute about this group of remedies. But in Pune, the location, I think that is the highlight. It is going to be held in in a setting of an organic farm. It is surrounded by lake on 3 sides. It is a beautiful, beautiful place. And we're going to be having organic plant-based food. And along with the seminar, for the rest of the day, we are going to, imbibe all the good things that nature has to offer. We'll go for sunrise, sunset walks. We will do yoga with Prajakta. She is a certified yoga trainer, along with being such an awesome homeopath. So she's going to do yoga for us. And we will also do some meditation techniques and processes, which will not only help us, but also, it will help us help our patients a little bit more. So I think it's going to be very, very exciting. All 5 of us are going to be there, and we wholeheartedly invite you to come, if for nothing, just to meet each other and take a break so close to the end of year. What do you think, Jyoti?
Yeah. And it is so, as Priti was telling, it is so necessary that we should be healed. We should know how to manage our patients. So I can see the difference before me doing meditation, taking case, and now how I take case. I think all of us need that, opportunity to learn how to heal ourselves. And this is, I think, a best place. So looking forward, we will meet in Pune.
I think after Corona, we really need something like this, no?
Yeah.
We need to get out of our home and the Zoom.
From the comfort of Zoom, we have to come out, no?
Come out and do. And when we are there, no, together for 12 hours, 24 hours, this is going to be 72 hours. We can do lot of discussion, what is happening in our clinic, small detailed understanding, or those questions which you cannot ask during Zoom meeting. Yeah, when you are talking over a breakfast table or a lunch table, those talks, no, they sometimes they become very, very important talk of the life. So this thing never happened in this 2 hour workshops or webinars. This can happen only when we meet personally. Like evening discussions cannot be only on monocot, but it will be general. We can share our own practical tips, like what we are doing in our clinic. No, we want to share it with you directly. So do join us. And one thing Preeti mentioned, it's all organic, and I'm very sure we are going to use a lot of millets in our diet too.
Yeah.
So monocots everywhere, and I think monocot is the international year for millets. Let's celebrate even that, meeting in
Yeah.
the beautiful organic farm and eating some
Yeah.
vegan diet there.
Yeah.
And you need not cook
Gluten
for
free.
3-4 days. Enjoy.
Yeah, you're going to have a lot of fun also, huh? Not only studying.
Yes. Yes.
I'm sure it will be a wonderful experience. So we are waiting for all of you to join us and meet you.
I think this is one of its kind where we five, only ladies group, are organizing. We should be proud of it.
We are bringing all the
Yeah.
guns, all the guns out. It's fully loaded. So do come. It will be wonderful. We will share, we will learn, we will grow together and have a lot of fun. Bye bye. Thanks.
Bye bye. Take care.
Bye.